It's the one thing people who have had a COVID vaccine want to know. So what exactly can and can't they do? The CDC in America has provided guidelines for safe activities for vaccinated people, but the Public Health Agency of Canada says there's still too many unknowns, including how effective the vaccine is at preventing spread, how long vaccine protection will last, what the local outbreak situation is on the ground where you are, and how effective the vaccine is at providing protection in a wide population.
We know no vaccine is 100% effective. So let's say you have a vaccine, 2 doses, you have a 90% effectiveness. I think on an individual level, that's great. You can go around, wow, I protected, 90% protection. That's great. But if you look at a population level, think about it. That means that you have 100 people vaccinated. For every 100 people vaccinated, 90 actually will have the protection of the vaccine. But unfortunately, there would be 10 people that, even though they're vaccinated and thinking that they're protected, actually the vaccine wouldn't work for them, and they would still be susceptible to, getting COVID-19, and then, if they got it, getting sick and transmitting to others.
Epidemiologists have said if Canada can reach around 60 to 80% immunity in the general population, that would be enough to stop the worst of the pandemic. At that level, the crisis in hospitals and ICUs would be relieved and explosive spread could be curbed. There's also growing concern that some variants of COVID, including B117 and P1, might show resistance to the vaccine, but Dr. Howard New says that can't be proven yet.
We don't necessarily have the evidence here to show that vaccines are not effective against any of these strains or variants of the virus. And so I think it's important to continue with our vaccination program.
Meanwhile, Canada's first shipment of COVAX vaccines has arrived, around 317,000 doses. So far, 10.5 million doses of approved vaccines have arrived in Canada, enough for just over a quarter of our population to get their first shots. Canada's deadline for vaccinating everyone who wants a vaccine is the end of September. Public Health couldn't say if that date will move forward, but seemed optimistic.
I think it depends on a number of factors, but certainly if provinces and territories adhere to a 4-month interval, and the flow of vaccines, as I indicated, is positive or remains the same. The demand for vaccines from Canadians remains high, then I can't see why we wouldn't be able to accelerate that. But I'd be speculating about a specific date.
Meanwhile, there's still no update on the Johnson & Johnson single-dose vaccine. Approved for Canadian use last month, Public Services and Procurement says they're still in talks with the manufacturer and isn't able to provide a delivery schedule just yet. In Ottawa, Xiaoli Li, City News.